The hospital in Fort Frances is contending with an outbreak of COVID-19 following the arrival of the virus into the facility last Saturday. It comes at the same time as another facility in the Rainy River District battles another respiratory outbreak. Adam Riley has more.
We've really been pretty aggressive in our measures, to be honest. But again, the variant has entered our facility.
On January 8th, the LaVerendrye Hospital announced it had a suspected outbreak of COVID-19, with one patient testing positive for the virus after they had been admitted into the hospital.
Were we able to track where it came from? We were not able to. But according to the standards, 2 cases would then implement that you would be in a COVID-19 outbreak if in an acute care setting, which is the case.
By Thursday, Loveday says that outbreak had grown to 5 cases, with both patients and staff affected in the hospital's inpatient unit, which houses surgical, obstetrics, pediatrics, and the ICU. Fortunately, the outbreak appears to have been contained, and while some staffing issues have arisen, it hasn't required the hospital to recall staff off sick. Loveday wants to assure the public that they can still receive care at the hospital despite the outbreak.
Don't be afraid because we're in an outbreak. We have very strict isolation and infection control practices. We've ramped up high-touch cleaning. We're doing everything we possibly can. Of course, if you don't need to come to the emergency department, probably not a good idea to come. However, if you do need medical care, you need to come.
Loveday says while it is unfortunate they're having to contend with the situation, she is happy it's the only COVID outbreak, as an outbreak announced at another Riverside facility is non-COVID related. On January 9th, a respiratory outbreak was declared at the Rainy River Health Center. As a precautionary measure, all those with symptoms were tested for COVID, and all tests have come back negative. Loveday says, like a similar respiratory outbreak at Rainy Crest Long-Term Care late last year, precautions are taken to prevent interfacility and interdepartment staffing.
So because of that, so a staff member may work here at LaVerendrye Hospital, but they also work at Rainy Crest or they work at EMO because Riverside is multi-site. So because of that, we've cohorted staff. They can only work at one site.
As to when the outbreak at LaVerendrye will be declared over is still up in the air. As Loveday says, it takes 14 days from the last known positive case. Adam Riley, TBT News.